Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about whether there are any puzzle pieces missing from a chronic illness case. One of the issues that I see time and again when patients come in to see me when they're dealing with their chronic symptoms, and that's the majority of the patients that I work with are folks who have been dealing with chronic issues for a long time. They've seen lots of other clinicians, and they eventually come to see me. So I troubleshoot difficult cases. What I see time and again is that they've worked with, oftentimes many things that have all made a lot of sense, and yet, armed with my perspective, having seen, worked with thousands of very, very difficult patients, I can look at what they've done, and it's kind of like 2020 hindsight in a sense, where it's like, oh, you can like look back and sort of point or see what things might have been missed or what you might have done differently in a scenario. I kind of have that luxury, for lack of a better way of putting it, when patients come in and say, well, I did this therapy, that therapy, this and this and this, and I can look back and say, well, and that all makes sense. Or oftentimes, I mean, sometimes some of the things that folks are prescribed don't make a lot of sense to me in some cases, but oftentimes makes a lot of sense. And I can look back and say, well, yeah, you did lots of great things and all these things made sense, and in many cases they would have helped to improve your symptoms, or you should have been better by now, but you have what's been missed is this and this and this and this and this. And it's very rare that a patient will come into my practice having done where I take their case and I say like, wow, like you've done everything. Like I can't think of a single thing that that you haven't done that could help to explain what's going on. And I'm not just talking about like, oh yeah, you've done everything logical and like there's a couple of Hail Mary passes that I'm thinking of. It's typically like, oh, like, your symptoms suggest that you have mast cell activation syndrome, and the clinicians you've worked with so far haven't been familiar with that. So, let's look at that. Or, oh, you've been treated for chronic infections for, months or years, but you haven't been treated for microbial hypersensitivity. So maybe that's a missing. Or haven't been treated for biofilms. Maybe that's what's been missing. And the list can go on and on. So I recently created a checklist, which is essentially designed to give patients or give folks at large who are dealing with chronic health issues a sense of what they might be potentially missing, or rather a checklist to say, well, if you're thinking to yourself like, okay, I've got X, Y, or Z symptom, and I think I've been thoroughly assessed. I've got this persisting fatigue, but like my doctor says my thyroid's fine, my B12 is fine, my iron levels are fine. I'm eating well, like I'm checking all the things off the base, or checking all the things off the list, and like I'm still tired, so like I guess I just have incurable fatigue. It's like, well, looking at my checklist, that kind of running through that list to see like, oh, well, have all of these things been explored when it comes to persisting fatigue causes? Well, that's what the checklist was designed for, to see, well, are there maybe some things that haven't been explored? So I have several checklists. I have one for fatigue, I have one for chronic pain, one for brain fog or cognitive decline, one for chronic digestive issues, a couple of others that I'm blanking on the names right now, or blanking on the topics right now. But it's I believe 6 or 7 checklists that I have, and just kind of really simple to go through to see like, oh, if a person has persisting fatigue, have they been investigated for this and this, and there's anywhere from 12 to 15 things on each list. So the reason I created that checklist was to, again, give folks a sense of recognizing, well, if they are having persisting symptoms, has everything that could be causing those symptoms been explored? And again, in my experience, oftentimes that's not the case. It's quite rare that a patient will come into my office and we explore all of these things and we don't see some improvement when we get everything checked off on the list. Not that we have to go through the entire list on everyone. There is a certain art form to it. It's not like, well, we've got the list, let's spin the roulette wheel, we'll figure out where we're going to start. Of course, it's not like that. There's always a certain flavor, if you will, to a patient case that gives me a good sense of we should be starting here or there, or maybe starting in a couple of different areas, but kind of working through things that make sense first, and then kind of going onwards. But anywho, that's the nuances of clinical practice. But so with this checklist, if that's something, if you're hearing this description thinking like, I'd like to run through that checklist and see if there's anything in there that maybe I haven't checked off in my own list, trying to figure out my chronic symptoms, please sign up for my mailing list. I have a, if you're watching this on Instagram, there is a link to that in my link tree in my bio. If you're watching this on Facebook or YouTube, then I'll post a link to how you can join my mailing list in the comment section or in the description below. And if you join my mailing list, then you'll get an automatic email that has the checklist in there. And please check it out. And if you have any feedback about it, please let me know. If there's anything on that list, or you're thinking like, oh, I had chronic fatigue issues and I worked with a doctor that cured them, and you don't have the cause of that on your list, I would love to know what that is. So please, by all means, send me feedback or comments about that. And yeah, I hope that checklist is helpful. So just a reminder, if you didn't see my previous video, my Overcoming Chronic Illness course, the first modules for that are launching on Saturday, May 28th. So if you join my mailing list, you'll have information about that sent to you as well. And if you're interested in attending that, then please just remember that the early bird deadline for registration is next Wednesday, May 25th. So please sign up before that time so you get the early bird rate. And it's going to be lots of fun. I'm so excited about giving this course. Months and months in the works. I've really tried to put it into a format, or I've really strived to put it into a format that's just comprehensive yet easy to digest, making lots of interconnections between different topics. And anyways, really excited about launching it. So I hope this information has been useful, and I will leave it there.